From WisPolitics in Madison, you're listening to Capital Chats.
Hello, everybody. This is Kate Morton with WisPolitics here with a Capital Chats podcast brought to you by Spectrum. Today, I'm here to share an interview with Rick Abrams, who is the CEO of the Wisconsin Healthcare Association and the Wisconsin Center for Assisted Living. In this interview, Rick and I talked a little bit about some new minimum staffing standards for nursing homes and how they could impact Wisconsin. But let's get right into the interview. All right, Rick. Well, thank you for joining me. I'm going to get us started off right away, just talking about these minimum staffing standards. As I'm sure you know, Kamala Harris was in the state recently to tout them, but you and other long-term care stakeholders have raised some concerns. So maybe you could get us started and share a little bit about that.
Oh, sure. Well, first, Kate, really appreciate the opportunity. Really do. A little bit about the Wisconsin Healthcare Association, Wisconsin Center for Assisted Living. Have over 400 members. We're a statewide organization, and we've been around since 1951. Represent both for-profit and not-for-profit nursing homes and assisted living. To the staffing standard. We talked a little bit about it earlier. Everybody is well-intentioned here. Certainly the vice president is, okay, and the administration, and everybody, I'm confident in saying this, believes that our nursing facilities should be adequately staffed. The third thing I'll say too is that this is a calling. This is a profession. Nobody gets into this profession, in this sector, if you will, to purposely provide bad care. Everybody's goal is to provide the best care possible. For the most vulnerable among us. We take that to heart, and certainly we take the awesome responsibility very, very seriously. Now, is to the minimum staffing standard, okay? We just do not agree with the approach. It is an overly simplistic approach to a very complex problem. And let me explain why. Literally every nursing facility that a person would walk into, whether it's in Wisconsin or any of the other 49 states of the Union and the District of Columbia, literally every nursing facility has a different patient mix. Okay. Some very, very heavy care, some more custodial, observational, if you will. And the current standard is sufficient staffing. And what I mean by that, or what the regulation or the rule means by that is that not only just the quantity of staff, but also the expertise of staff. And it really plays in very, very well and coincides with a facility's resident or patient mix. If a facility has residents with more acute or more substantial needs, they're going to need to staff up, both probably in numbers, but certainly in expertise. Similarly, if another facility has a patient mix that is more custodial or needs less intensive care, their combination of staffing, maybe even staffing numbers, depending upon the number of people in the facility and their needs, is going to be different. And that's why we believe that sufficient staffing, rather than a black and white 3.48 per resident per day, we think that sufficiency is the better way to go. And of equal importance is that we have our Division of Quality Assurance, our survey agency, as it's known in nursing home jargon, that agency is responsible for making sure, not, to a degree, that facilities are adequately staffed, but more importantly, that they're staffed adequately to provide the care that the residents need. And again, that's the right approach.
So it sounds like part of what you're saying is that this idea of having a numerical standard might be kind of more of a one-size-fits-all approach, where you feel that the current sufficient staffing that is allows for more flexibility. Is that about right?
Yeah, and really, again, sufficiency is designed to meet the needs of the resident population that you care for. And let me give you what I think is a great example in the standard. Okay, the standard calls for 3.48 hours per resident per day, and that is divided into 0.55 hours of a registered nurse or RN coverage, and then 2.45 hours per resident day of certified nursing assistant, CNA coverage. And then the final 0.48 can be accomplished through a combination of either RN, CNA, or licensed professional nurses, LPN. Okay. But what it also requires is the physical presence of a registered nurse 24 hours a day, 7 days a week. And here's my point. That 24/7 requirement applies across the board. So if you're a 40-bed facility in Bayfield, Wisconsin, you have the same responsibility as a 500-bed facility in Chicago, Illinois. That doesn't make sense to us. Again, do we believe that there should be adequate coverage? Absolutely. But to have the same standard for the small rural facility as the large urban facility, that makes no sense at all. Now, there are waiver provisions, okay, within this rule. But to me, and I believe that the Centers for Medicare and Medicaid Services, CMS, the federal regulatory agency, has said, nationwide, 30% of the facilities will qualify for the waiver. Well, that concerns me because right off the bat, if you're adopting a rule that is going to exclude 30% of the facilities, that calls into question the logic, if you will, of a rule like this.
Another thing I wanted to touch on is the worker shortage aspect of all of this, which could impact how nursing homes are able to meet these standards. I guess, what are your thoughts on that?
Kate, first is a great question. It's a great question. First thing I want to say is that, look, we're not going to play the role of victim here. Okay. Like it or not. Okay. This is the law of the land. Okay. That's going to take effect 2 to 3 years down the road, depending upon whether you're a quote rural facility or quote an urban facility. So I can assure you, and I can assure your listeners that nursing facilities, not only in Wisconsin, but across this nation, are going to do everything they possibly can to comply with this standard. But to your point of the labor scarcity, okay, the bigger question is that what happens is as we're approaching implementation 2-3 years down the line, where a facility, despite its best efforts, cannot meet the standard. Yes, they could apply for the waiver, but if they're not successful there, then in my mind, they have two options, both of which are terrible. Okay. The first option is that if they cannot meet the standard with the current beds that they service within their facility, they're going to have to reduce the number of beds that they service so that they can comply with the standard. That's a terrible idea or a terrible result because you're reducing access to the public that you serve. And one of the many great things, I'm a transplant from out east. So one of the many great things about Wisconsin is the rural nature of our state. And I've been all over. I've been in every one of the 72 counties to visit my members. And what continually impresses me is the community nursing home. People who have lived in the community for years work there. People who have lived in the community for years receive care there. That is a unique environment that we can't lose. So if facilities are required or forced to reduce the number of beds, our concern, especially as our demographic in Wisconsin ages, our concern is that access is going to be jeopardized, and we can absolutely not let that happen. So the second concern we have, okay, and again, it all revolves around the scarcity of labor, right? Both clinical, okay, and line labor. The second concern we have is, let's say you're that community nursing home, maybe you've got 40 beds. And even though you've tried so hard to comply with the standard, you just can't. But because of the need in your community, you can't reduce the number of beds. Okay. So then what do? Well, the only option there is to call upon the existing staff to work longer and to work harder. And our biggest concern there is that you're going to accelerate burnout. And especially in an environment of labor scarcity, you're going to drive more people out of the profession. We are still 120,000 employees nationwide for our sector, down from March 20th, March 2020, and the onset of the pandemic. We still haven't recovered yet. The facilities are going to have to deal with what we believe is an unrealistic standard to meet.
Yeah, we've talked a lot about how this would impact the workforce. What about the patients in all of this? How do you think this could impact them?
Well, certainly from the standpoint of access. And I think that is the biggest impact. But, Kate, again, the one thing I want to assure all your listeners is that facilities will only accept residents that they care for. And that's the standard that should be there. They have a legal, a regulatory, and a moral responsibility to uphold that. So the biggest concern that I would have, again, is a diminution, if you will, or a denial of access to Wisconsinites in pockets of the state, perhaps statewide. And again, I'm not trying to get hysterical here, but that's a genuine concern that we have. So I think so then the next question is that, okay, Rick, okay, these are your concerns. Do you have any solutions? Great question. Okay. The example that I would use that we've recently completed implementation on is a program known as WIS Caregiver Careers. And this is a program that was initially funded through the American Rescue Plan Act. And what we've been able to do in working in conjunction with our Department of Health Services, with the support of the state legislature, and also with our colleagues at Leading Age Wisconsin, another long-term care association, is that over a 2.5-year span, we've been able to attract, train, and certify over 2,000 certified nursing assistants for our nursing facilities. Not just Wisconsin Healthcare Association members, but this program was open to members and non-members alike, and it was tremendously successful. We need to replicate that program. And in fact, our Medicaid agency has taken it over and has also expanded it to the assisted living setting. We need more programs like that, which brings me to my second point. I've been honored to serve on Governor Evers' task force on the healthcare workforce. We're in the middle of our work. We hope to be able to submit to Governor Evers in September, hopefully just after Labor Day, a litany of recommendations. My hope, certainly representing the long-term care sector, is that some of those recommendations will be unique to the long-term care continuum. But as of not more importantly, I'm very, very confident too that some to a lot of those recommendations will be applicable across the healthcare continuum. And hopefully then the governor can include some of those recommendations, hopefully all the recommendations, in his 2025-27 post-state budget. And then we'll discuss them with the Joint Finance Committee and other members of the legislature and legislative leadership. And, hopefully the resources will be there to really do some great work. So those are two exciting examples of what I see. A mentor of mine from out east recently said, the only way there's going to be a future labor shortage is if we don't do anything about it now. Well, we're prepared to do something about it now. And with the help and support of Governor Evers and legislative leaders, both houses, both sides of the aisle, we're going to get something done.
Great. Well, thank you for joining me on the podcast today. I think that's all we have time for, but I really appreciate you coming on.
It's been a real pleasure, Kate, and it really is. And thank you for all you do.
All right, everyone. That was Rick Abrams for this week's Capital Chats. If you want to learn more about these new proposed staffing standards, you can head to our website at wispolitics.com. In the meantime, I'm Kate Morton. Thank you for tuning in to WIS Politics Capital Chats, brought to you by Spectrum.